As a board certified plastic surgeon, I create scars. So the question is, how do you optimize those scars long term? Now, I'll emphasize there's a lot of things, a lot of variables that go into the healing of a scar, one of which is the treatment that the surgeon did. So is that surgeon using complex layered closure? In other words, using multiple layers to essentially diffuse or spread the tension along the incision? A good plastic surgeon is going to do that. That's pretty standard. What we do after the surgery, whether or not we use what is called topical silk dressings or things like topical scarring compounds or silicone sheeting or things like Moxie, which is a non-ablative fractional resurfacing laser. I absolutely love it. Great for scars. Or BBL to remove and soften the appearance of red and brown scars. If you do have problem scars and we're thinking, hey, we want to kind of preemptively treat them, sometimes I will use a little bit of an injectable steroid called Kenalog, usually 2 to 3 treatments, each about 4 to 6 weeks apart. Takes about 5 minutes and it can help soften scars. And then ultimately, sometimes scars are just not pretty. That may not be the fault of the surgeon. It may not be the fault of the person. It's the fault of genetics. Some people just don't scar well. In those cases, we do a formal scar revision where we actually excise the scar in a full thickness manner. We undermine the tissue, so we release that tissue so there's not a lot of tension. And then we close it in multiple layers. There's a lot of things that you can do to help improve or optimize your scars. Give us a ring if you have scars, either from us, because we create them too, or from other plastic surgeons that are just not healing the way that you want them. But also keep in mind that it takes 12 to 18 months for those scars to heal properly. I hope that helps. Dr. Buford from Beauty by Buford.